today?
Good, how are you?
Good. I'm your compounding pharmacist. My name is Heather Burney. It's very nice to meet you
Nice
today.
to meet you too.
If you have a couple of minutes, I'd like to talk to you more about your compounded prescription medications and answer any questions that you might have.
Okay,
Great.
great.
Okay, perfect. Well, this is a compounded medication, and I'm not sure how familiar you are with compounds. A lot of people aren't. But compounded medications are ones that we make specifically for you by communicating with your physician and looking at your specific needs. So it's a special medication that we make for you that's not one that we can easily pull off the shelf. So that's kind of an interesting thing with a compounded medication.
Yeah.
It's special and different for you.
Great.
So this medication is progesterone capsules. How did your doctor tell you to take those?
He said just take one each day.
Okay. That's right. That's what the label says, that we want to take one capsule every day. Usually with progesterone capsules, we want to take them at bedtime. One of the common side effects with progesterone capsules is drowsiness or sleepiness. So that usually is something that we like to have, especially because low progesterone levels tend to make us have difficulty sleeping. So that's something that we probably would want to have, but definitely a side effect that you'll want to be watchful for and take that at bedtime.
Okay.
Do you think you're able to take it at bedtime?
Yes.
Okay, very good. So what did your doctor tell you this one was for?
He just said I had a low progesterone level and I was having some symptoms, so this one should help.
Okay, that's correct. So like we discussed, sometimes there are different symptoms that people have with progesterone levels not being exactly up to where they should be. So this should help correct those levels also.
Great.
So what did your doctor tell you to expect from this medication?
He just said that my symptoms should improve.
Very good, yes. So usually that helps with symptoms. As with any medication, sometimes we have to alter your dose or maybe work on tapering that. We can work with your physician and you and kind of find the correct dose for you. Of course, if you have any questions about this medication, make sure that you get a hold of us. Contact us at any time that you have a question, or contact your physician also.
Okay.
Because this is a compounded medication and it's a capsule, we do want to make sure that you keep it in a cool, dry place, avoiding any extreme temperatures, extreme hot or cold
Okay.
with those. The other thing with a compounded medication, you'll notice an interesting thing on here that we call a BUD, or a beyond use date.
Okay.
This tells us how long this medication is going to remain potent based on the formulation that we made it in. So if it goes beyond that beyond use date, it might not be quite as effective for you anymore.
Okay.
With you taking your medications like you should, we should have no problem exceeding that beyond use date, but it's something that you want to watch for.
Okay.
If for some reason you stop taking this medication and you change your dose or something like that, and you're not taking it anymore, or the beyond use date's exceeded, we do want to make sure that we dispose of it properly like we would any of your prescription medications. So in the city here, we do have permanent drug drop boxes and we have drug take-back events. Those are good places for you to dispose of them if that sounds good to you. So is there anything else that I've missed, anything you have questions about?
I don't think so. I think you explained it all.
Okay, very good. Well, just to remind you, please call us if there's any trouble at all with the medication or if you have any questions when you get home. It's a lot of information, I know, to give you in one sitting. So if you think of anything later, I'd be happy to talk to you again.
Okay, thank you so
very good.
much.
Thank you for coming.
Thank you.
Thanks.